So welcome back. So obviously today seems a little different. So today I'm not in the reading room. I'm not in the dark. I'm not working as a radiologist today. So I'm doing something very different. So if you're new to the channel, I'm a board certified internal medicine physician, currently in my 3rd year of radiology residency. But from time to time, I still work as a hospitalist, essentially a nocturnist. So what that means is that I am the hospitalist overnight. So I'm the attending physician whose responsibility includes admitting patients from the emergency department, as well as keeping an eye on emergencies that are happening up on the wards. So it's something really different that sometimes I'm a resident at some hospitals and then I'm an attending in a different specialty in other hospitals. So today I'll give you a little glimpse of what it's like being an attending in internal medicine at night as a nocturnist. So let's see how tonight goes. I'll touch base with you again. So let me explain a little bit about my role overnight. So essentially I'll be overlooking the management of various patients that are going to be admitted throughout the night at this particular hospital with my residents. So my residents are going to be taking a look and seeing the patient first. After that, they're going to present the patient to me. We're going to take a look at the labs, take a look at the imaging, which is really cool. Now that I have a radiology background, I can better interpret the images, maybe even interpret them myself. After that, we will take a look at the labs, we will discuss management, then we'll go down together, see the patient, make sure that everything's done appropriately. We'll do a little bit of teaching at bedside, and overall, that's pretty much how the routine goes. Quite different than radiology. In radiology, there's a list, and you're kind of going image after image, and you're trying to help the primary team, and you're pretty much reading the images. In medicine, it's a little bit different. The ER sees the patient first, they determine the patient needs to be admitted, they admit it to our service. After that, I take a look at the management, I'll take a look at what radiology's input was with the ER, and then we'll kind of take over from there. So with radiology, it's a lot more diagnosis. You are involved in treatment for sure. You're able to better guide the clinicians on the appropriate track for the patients. But now that I am the clinician, I'm going to be the one that's responsible for taking over the care for that patient. So I'll be making sure that they're getting the appropriate treatment, appropriate management, and that's pretty much how it goes. So another really crucial aspect of my job is responding to all rapid responses and code blues, which are essentially emergencies of patients that are already admitted to the medical wards. Rapid response is basically you're trying to go there, stabilize the patient before they deteriorate further, and patients that are high risk of deteriorating. And code blues obviously is someone who has deteriorated, their heart has stopped, now it's time to attempt to resuscitate them. So that's also very important and can make it quite challenging when you're in the emergency department, but then you have to kind of run upstairs, up and down, and try to stabilize patients. But that's one of the cool things. Adrenaline gets pumping. One of the great things about being an overnight nocturnist is you kind of respond to all emergencies, almost like an emergency room physician. So yeah, that's another important thing that we take care of overnight. now we're reaching the morning, and one of the big things when you're a doctor, an attending physician in particular, is that a lot of documentation. You spend a lot of your time in front of the computer. You're definitely seeing the patients, of course, but a lot of your time is spending meticulously documenting everything. And honestly, as a resident, feels kind of tedious, and sometimes you think that you should be spending more time with the patient. But as you progress in your career, it starts to make more and more sense. This is not only just for documentation's sake and for legal purposes, but most of the time when you're taking care of patients, you're working as a team. You're in coordination with multiple different subspecialties, so you need to be able to document your thinking process. You need to document why you're doing what you're doing, so that other doctors can, when you ask them to consult on your patients, they can look into your thought process and kind of add their 2 cents. And that's why we go through such detail documenting and making sure that we're doing the appropriate care for the patient. So I'm gonna finish with my documents, make sure everything is nice and tidy, and then we'll wait for the morning team to come in. We'll hand over the list of the patients that were admitted overnight, discuss any of the emergencies that happened tonight, and kind of go from there. And that's pretty much a glimpse of what it's like being a nighttime nocturnist. If you're new to the channel, don't forget to like and subscribe. I am a board-certified internal medicine physician, also a radiology resident, so I do a lot on radiology. This is my first time making a video about internal medicine. So let me know if you like it, if you're interested. Leave me a comment down below. And until next time, I'll touch base with you again. Later.